my name is Dr. Sana, and I am associated with AHANG, which is a Karachi-based organization which works to improve the quality of sexual and reproductive health and services across Pakistan. And I am the Manager Life Skills Education, and I'm also the part of the implementing consortium in What Works 2.
This is Ata Mohammed. I work with Right to Play Pakistan as a program manager. In What Works 2, I am leading the What Works 2 grant.
I'm Tazeen Saeed Ali, and I'm from Pakistan, and I am a professor at AHANG University, working with different NGOs for the last 20 years.
Rosina Karmaliani, I'm from Aga Khan University, Pakistan, and in What Works 1, I was a part of a grantee from the research side. In What Works 2, I work with Right to Play and AHANG as a core research partner, but also in the country to be able to design the research and evidence for the project which we are doing in the educational spaces.
Our organization AHANG is working dedicatedly to improve and to promote sexual and reproductive health and rights.
In What Works 1, what we were doing was the Right to Play is the implementing partner. So they had a play-based life skills curriculum to be given to the children, and it was like 60 sessions in total over a period of 2 years. And as a research partners, we were looking at the outcomes in terms of depression, in terms of peer violence, perpetration, victimization, bullying, corporal punishment. And we found in What Works 1 that the life skills building curriculum, which is play-based, really engaged girls and boys. But because schools were gender segregated, they were doing it in their own areas separately. And we were able to see that corporal punishment went down, gender norms improved, bullying went down.
And once they grown up, they become the part of the society, they become less violent and live a more equitable life.
We were able to show that in school, if we are going to play with the children, how effective it is. A lot of depression gone down, overall mental health improved, a lot of perpetration of the violence and victimization was also improved.
In the VAWG area, we have implemented our program in What Works 1. So this was our achievement because though that intervention actually scientifically proven in reducing the violence against children and violence against women and girls.
It is not a part of curriculum. Parents do not cover it. No one talks about it. Social media, nowadays it is covering a lot but not covered much. Many of the websites are available which many of the Pakistani girls cannot go over there because if they are trying to reach out from their institutions or schools and colleges, so they usually put the block over there, they cannot really have a look of it. So it's important that someone who is understanding overall context should be reaching out these girls, these teachers and the administration overall, because they need to come up with the whistleblowing policies and come up with the reporting mechanism.
If I talk about my country, Pakistan, there is a lack of data and there is a lack of evidence. So I think efforts are needed in this particular area. And then I would say that Pakistan has made significant strides in recent years on passing laws for women's and girls' protection. But because of the socio-cultural norms, the implementation on these laws are, it is quite weak. So I think that is why the cases are there, but again 50% of the cases are not reported because the women and the girls who experience violence, any form of violence, they just don't come and report because of the shame and the stigma around this particular area.
So each time new political party, new ministers, new people are coming up, so each time you really have to start from the zero. You work till 10 and then you again come back to zero. So constant thing. Third, I think Pakistanis are also, they need some support in documentation also. Publishing in a good journals like Lancet and all. And this is What Works 2, and the entire network is so much effective that now we will be able to publish in good journals that most of the people could read it and cite it and all.
as we work in the education sector and we use play for developing the social emotional skills, which actually provide foundation for to say no to the violence.
The overarching goal is to reduce violence against women and girls, and how we are going to do is that the play-based, life skills-based education, which is all about promotion of the ASR HR programming, is mainstreamed into the public and private schools of Karachi, so that the girls and boys are able to identify, they are able to prevent and respond to the violence and the harassment in and around schools, and the school management, the stakeholders are strengthened, the capacities of the school itself is strengthened, so that they are also able to identify and protect girls and boys.
So one of the very big innovation in itself is the play. And so it's not only the sports or the classroom play, but the play is connected with the concept of RCA. So RCA is reflect, connect, apply. So the coach is playing with the children, and then a debrief happens through the conceptual framework of reflect, connect and apply. When every child reflects what they did, and then they connect with their own situation, and the next day they share how they applied this particular scenario.
I am passionate that women and girls should have a space where they can flourish.
My passion for having the violence-free society, and especially for adolescents' health, their mental health, and because they are our today and they are our future, that gives me passion to be working every single day.
I'm really very passionate about working with children and adolescents, because in a country like Pakistan, where people are, especially young girls, are not provided with timely, accurate information about their bodies, about their gender roles in societies, about maintaining privacy and upholding boundaries, I think it's really very important to provide them safe spaces, safe avenues, so that they can always come and get access to the right information.
In our society, play is considered a luxury, but it is not a luxury, it is a basic human right. And when the girls are engaged into the play, so it shackle the societal stereotypes. So these two things actually make me passionate about my work.